Well, I'd like to welcome back once again Lisa Abaid. I was right, she has been with us before, and it's great to have you here. And you are a gynecological oncologist with Hoag.
Yes.
So today we're going to be talking about ovarian cancer.
Ovarian cancer is one that we tend to see. It is not related to any type of infection. The cervical cancer is related to HPV infection, which is a virus, which then allows us to prevent acquiring that infection and then prevent that cancer. Ovarian cancer is one that we see in older women, women in their 60s, compared with cervical cancer, which can occur in women in their 20s, 30s, 40s, so slightly different age range. But about 80% of ovarian cancers, 80 to 85%, are sporadic, meaning they have no known cause or no known reason that they happen. About 15 to 20% are hereditary, meaning that you inherited a gene from a mother or father that led to the development of that cancer. And so that's, again, a little different from cervical cancer, but it does allow us to pinpoint or identify high-risk women.
Okay, and is that really the only risk? You said it's hard to pinpoint, and why is that? How come, after all the studies and technology we have today, we can't pinpoint why?
Why, yeah. There are some other risk factors that are not as highly associated with ovarian cancer as the genetic syndrome. So, 15 to 20% are genetic. Then the other, 80 to 85%, we can see higher risks in women who have never had children and have never breastfed. The more ovulatory events that have occurred in somebody's life can increase the risk of a mutation developing on the surface of the ovary, which can then lead to cancer. So birth control pills are protective. At least 5 years of birth control pills will cut your risk in half of ovarian cancer, again, by suppressing ovulation. So minimizing the number of ovulatory events, whether that's through birth control pills or pregnancy, is protective.
Okay, very interesting. So those are some of the risk factors, and of course family history is big as well. How is it diagnosed? Because I've heard that women may not even know. So is this something that, like other forms of cancer, like breast cancer, that there are yearly checkups for this?
Yeah, it's a great question. So we have screening tests. Screening tests are designed to detect either precancerous or very early cancers at a point where we can intervene and prevent them from spreading or prevent other consequences. Breast cancer, we have mammograms. Cervical cancer, we have pap smears. Colon cancer, we have colonoscopies. Those are very effective screening tools. Unfortunately for ovarian cancer, we don't have tools that are as effective. We've looked at really big studies in terms of doing things like annual ultrasounds, annual blood tests, but what we found is that we pick up a lot of benign conditions. We're not great at finding early ovarian cancers. So when we identify a high-risk population or a high-risk woman, such as a strong family history, the first step is really to see, tell your doctor, we'll typically get referred to a genetic counselor and then have the testing done. There are a variety of genes that can increase the risk for ovarian cancer. BRCA1 and 2 or BRCA1 and 2 are the most common ones. Some people know that as the Angelina Jolie gene. She sort of publicized that. But that's, in terms of pinpointing the women who need more intensive screening or annual ultrasounds, it's usually women in that population. In the general population, we're not great at detecting it early, even by using those modalities.
Okay, what would be the symptoms then that someone might suspect?
Yeah, it can, we call it kind of the great mimicker because it can mimic a lot of gastrointestinal disorders. So what we can see, a mass in the pelvis can irritate the bowels or irritate the bladder. So you might feel bloated, pants might not fit properly, you eat a few meals or a few bites of your meal and you feel full. Some women find they're having to urinate more frequently. So anything, and these symptoms can all be signs of very other common benign conditions as well, but we typically say if you notice for 2 weeks or more that you're consistently having these symptoms. So I feel full very quickly, my pants don't fit, I feel bloated, I'm urinating frequently, I have changes in my bowel habits, those would be reasons to see your doctor and to have an evaluation.
Okay, once it is detected, what is the treatments and what are the steps going forward?
Yeah, so we treat ovarian cancer with a combination of chemotherapy and surgery, and the order of that depends on exactly what we find at the time of diagnosis, whether we start with chemotherapy or we start with surgery, but we will typically use both of those tools to fight this cancer.
What about the, once you do detect it, a lot of times it's how early you catch it. And this sounds like if you don't have a family history, it's really hard. So you just mentioned a woman might have these symptoms for a couple weeks.
Yeah.
Is that in the early stages? Is it by then it's?
You know, oftentimes that can be about 3/4 of women by the time we detect their cancers, when they start having these symptoms at stage 3 or stage 4.
Okay.
So only 25% are caught in stage 1 and 2. There is a lot of smart people, a lot of resources going into trying to figure out a better early detection tool than what we have right now, because you're correct, by the time we see those symptoms, oftentimes it is more advanced than we would like. But if we can catch it in the earlier stages, stage 1 or 2, the cure rates are quite good.
Okay, so tell me more in detail about the clinic that with Hoag that is all high risk with breast cancer, ovarian cancer. You know, we got the Women's Health Institute on here.
Yeah, so this is a great clinic. It was actually spearheaded by a breast oncologist, Dr. Heather McDonald, and it's specifically for women who have family histories of genetic disorders that increase their risk of both breast and ovarian cancer. In addition, there may be some other cancers that are impacted, but the primary goal was to look for how do we screen these women and monitor them for early breast and ovarian cancer. Dr. McDonald had me get involved from the gynecologic side, and the idea is these are a lot of women who are young, they have small children, or they want to start families, and so we're trying to balance, you know, fertility, scheduling, you know, when you have to have a mammogram and an ultrasound and a blood test and an exam and all of these things, it can feel very scattered having to go and do all of these on an individual basis. But the point of the clinic, you know, you're going to come, it's kind of a few hours that you're there, so it's not a short visit, but we do everything. We do imaging, we do the exams. We've actually incorporated a wellness component. We have a mindfulness coach, a nutritionist, physical therapist, or a personal trainer who helps with some of the wellness side of it, because a lot of these women have not only, you know, carry this burden themselves, but have seen other family members go through this, and so we try to sort of, you know, help the mind and body at the same time.
All right, and that I think is very helpful, because so many times, as you mentioned, people are busy, and yes, it's their health. Yes, it's important. But you go one day, and then the next day, or 2 weeks later, you're scheduled to go here for the day, and
it can be very challenging.
Yeah, very good. Great to have you on today.
Thank you so much for having me.
And thank you very much. And if people want more information, they can go on the Hoag website and get information from there. And I would honestly, you know, you could just look up Hoag Women's Health Institute, and like we have on the screen here, and you get a lot of information there. Thank you very much, Doctor.
My pleasure.
Good to see you again.
Thank you. Nice to see you as well.
Bye-bye.
Thank you. Bye-bye.